phase 3 trials right now, of which there are a few. So Jason writes, assuming a vaccine is approved sometime by January, what timeline do you see for distribution and vaccination of enough people to achieve herd immunity?
It's a great question, Jason, that many of us are asking ourselves every day. And the challenge we have is we're still not sure how this vaccine is going to be rolled out. When I say vaccine, I should also say vaccines, because I think you're going to see multiple vaccines coming to the market within a short time period. I'm presupposing that we will find protection that and it may not be the best. It may be 50 or 60%. We'll have to find out. I'm assuming that we will find that the vaccines are safe with administration and in the period of time after that. But we'll still be studying them for days to come, years to come, to look at their durability, to look at other safety issues long term. What's going to happen? We don't know. There are a lot of cooks in the kitchen right now in this government. Number one is the fact that we have the standard, what we call ACIP, the Advisory Committee on Immunization Practices, under the auspices of the CDC and the Department of Health and Human Services, which has traditionally made recommendations and helped support the distribution of vaccines like this. They did a wonderful job in 2009 with influenza vaccines for H1N1 in that similar way. But now with Operation Warp Speed and the changes in how the U.S. government's approaching this, there's a major military component part of this that will be involved with distribution. There's now been a group appointed through the U.S. government at the National Academy of Sciences to serve as an advisory group as to who should get vaccine, when, and where. All this is still churning. None of us really know yet what's going to happen. And it's going to be very important that we figure this out soon. Not only is it how we're going to do it, but we have to get the buy-in of the public in terms of how it'll be administered, who gets it first. As you've heard me say multiple times on these podcasts, I believe very strongly that healthcare workers who are on the front line should get it first. I know that I've been accused of protecting our own. I'm not one of them, but they're putting their lives on the line every day to take care of patients with COVID-19, and we need to keep them there and we need to protect them. But there's a number of people shortly thereafter, particularly people at high risk of having serious outcomes if they get infected, other essential workers that are critical. There's been discussions about the military, law enforcement, there's all kinds of things. We've got to work that out. We can't have a crisis at the time that the vaccine becomes available. And while I think there'll hardly be a uniform decision that everyone will agree with, but we've got to have a way to look at that. And we also have to look at, if there are multiple vaccines, how do they get decided who gets which one, and what that might look like. So it's a great question. It is a critical part of the completing the R&D research kind of picture for developing vaccines all the way to their final administration. As you've heard me say multiple times, a vaccine is interesting, but it's nothing until it's a vaccination, until it's in someone's arm, and that's what we have to work on. So we're working on that one, and stay tuned.